Great.
Welcome back, everybody, to the monthly Holistic Actions Q&A webinars, where we will look with you all down this path of pet wellness to empower you all to help your animals by decoding symptoms and making veterinary medicine, understandable. Dr. Christina, do you want to get started with Ruth or other questions?
Well, I'm going to start with two first, with Miyoko and Karen, because the answer is sort of similar. Number one, the key thing on this whole call is there is no one right answer. And the key of holistic medicine, the key of health, is that every individual has to find what works for them. So there is no one probiotic that we think is best. I happen to like Mitomax, and Dr. Jeff, pick one that you like.
Oh my
Come on, just
gosh.
one.
I'm a big fan of probiotic, which is a human biotic.
Okay. Okay.
I use it
Maybe
for
if you can
animals.
type that in maybe. And but key for everything is experimenting, but it's not like, oh my God, we're experimenting on your animal. It's more finding what works for your animal. So, some key things, and I'll repeat them halfway through for people that come in later at the very end, is you want to have a holistic veterinarian on your team. And if you don't, and you're new here, if you go to holisticactions.com/select, it's a whole article and it'll help you find one. If you can't, then you post it in the forum if you're a member of Holistic Actions. For those of you who aren't a member, the select article is available. And in the 101 course, which is also free to those of you who are not yet members of Holistic Actions, in the 101 course, it's 5 lessons. And we talk in there about feeding and about how to tell which foods are better. And having said there's no one right answer, Dr. Jeff and I certainly know dogs and cats who are eating crappy kibble or maybe okay kibble, and they still live a huge long life. And there are dogs and cats that are fed a wonderfully balanced, following Barbara Royals or real food or whatever those are, and they get cancer in diet 2 and 4. So there is no one right answer, but those are the outliers. So the key is feed fresh food, and then we'll work around on that. So it doesn't matter, the distinction between raw or fresh food isn't quite it. It's fresh food, and then it could be raw, it could be cooked, it could be a combination, it could be with vegetables, not with vegetables, etc. There's the whole range. Whether you're deciding which food is the best, which treatment is the best, which lifestyle is the best, which exercise is the best, the answer is keep a journal. And those of you who are members of Holistic Action, that's a member benefit. You can download the dog or cat ebook journal. Others can go to my website, christinachambreau.com, and order it there, either the book version or the print version or the ebooks. And that will help you track all the symptoms to see how they're doing. And we focus on BEAM, behavior, energy, appetite, mood. That equals quality of life. How are they feeling overall? If you're feeding a diet and you realize that your dog or cat isn't doing as well as they were, aren't as active, aren't as playful, then maybe try doing a different diet. If your dog or cat just won't eat raw, but will eat lightly cooked, then lightly cooked is the way to go. Sometimes older animals, we've had many people post that they used to eat raw and now they prefer it lightly cooked, or they go through spells in their life. So regardless of treatment, supplements, exercise, etc., that's the key. So hopefully Karen and Miyoko, that gives you an answer, and post if it doesn't. Now, Dr. Jeff, you are, well, let's see, now we'll go to Ruth. Ruth, go ahead.
Oops.
Mhm. Whoops, you're muted again.
Okay, my computer's been really acting up. This question actually is not for me indirectly. It is because I'm the one that's trying to help this individual. The rescue that I work with contacted me because they know I do things more holistically than anybody else in the group, and they had been approached by someone who was looking to possibly give up her dog because her dog was suffering from extreme allergic reactions. The dog had had Cytopoint injections and then they stopped working. And so I looked it up and I said, I don't remember if it was in Dr. Judy or one of the other books that I have by other reputable vets, it said only works about 60 or 70% of the time. And then it doesn't work long term. And so I asked her, how many vaccinations has your dog had? When did the dog have them? What are you feeding? And the vet had told her, well, your dog might be allergic to chicken. So she's on one of the Purina Pro Plan things. And I said, absolutely, let's start with food. Food is key. You've got to do something to get, if you can't afford to do a really good meal, what you were just talking about, adding a topper of some kind, and I listed a whole bunch of things that she could put in. I also suggested quercetin and PEA. I said those seem to have, from what I've read, a really positive effect on allergies, both for people and I don't know if I should have told her about Cesarex. I felt I was overloading her. She said she was taking notes. I gave her this website. I gave her several other websites to go to. I said,
so you're on the right track. Follow up with her and make sure she does the 101 course.
Okay. And then I told her, you might want to try the it's called MicroClean. TheraClean. They're micro.
Well, here's the thing, Ruth. You're right. You overloaded her. Start one by one. Start her on just adding some fresh food and nothing else. Maybe rescue remedy.
Okay.
And then work with her for a week or two on that. And then repeat. She took notes, but I tell you it's going to go right out of her head. So in a week, get back to her, see where things are, and say, well, maybe you could add in this. And then a week later, maybe you could add in this. There is no one right answer, and you know that. So it is a matter of hanging in there with her.
I was looking to see if she had joined because I told her about this and I sent her the link, but that's why I'm asking because I don't see her on the.
We can't. If you go to the forum, well, no, I don't know. Is there any way for people to tell if somebody's a member, Jeff?
No, I know she's not a member. I mean, she didn't even know it's dog acupuncture.
Okay, but you said you gave her the link and you wondered if she was a member. Well,
no, I would look to see if she had joined today.
Oh, okay.
I asked you the question.
Okay. Yeah, and I would give her the same answer. Start one piece at a time, especially when you're new to this. Really important.
Yeah, I could tell she was overwhelmed.
Absolutely. So that's up to you to do the following up on that. Thank you so much for doing that, Ruth. Dr. Jeff, Christine's question is for you. My golden has a large area on the lower right iris that's completely black where it should have color. What causes this?
It could be a lot of things. How old's the dog? When did it start?
Christine, can you unmute yourself? No, she doesn't have a microphone.
I'm trying to find the question. Okay.
So it could be a lot of, as Dr. Jeff said, it could be a lot of things. And what we want to know is, how's the dog feel overall? How long has it been there? And have you had it checked out by a veterinarian? That would be a good thing. And then have we had anybody speak on iris evaluation? I don't think we have.
We have, yeah.
Ooh, can you?
Sure.
Are you do you know, is that our Christine who's a member?
No, I don't believe so.
So Christine, if you were a member, we've had a speaker who talks about using the iris to evaluate health in general. So
yeah, but in this situation, I guess the first question is, did it come off suddenly? Is it gradually growing? And is it, like a melanoma, an eyeball melanoma? One of my first poodles The half is removed because he had a melanoma in his eye, but that was before, I was treating dogs with homeopathy. And yeah, I mean, a black spot may be absolutely normal, maybe a normal pigment spot, but having a vet and or an ophthalmologist exam would be a really good idea.
And the trick is, one of the reasons to become a member of Holistic Actions is you'll learn a lot more about something we call HMDM, or Holistic Medical Decision Making. And part of that is, so right now your goal, step one, is what is this? What's going on? And if it's, if it's depending on any condition, you have to decide if you have to go right to a vet, treat it yourself, or make an appointment, but don't worry about rushing. And that has to do with how they're feeling overall and many more questions. So your goal now is to find out, what is this? Number two is collecting information. So at the vet, you do not have to do what they tell you. You take in their information and you think about it. And you tell them, I need a few minutes in the waiting room, or thank you so much, I will get back to you. And then if you're a member, you can post in the forum. And we have, people don't need to go to do Googling if they're members of Holistic Actions, because they can get not everything, but we have so much information that'll guide you. So it's just important to know you don't have to immediately do if it's a conventional vet says. And so hopefully that helps. Post if you have more question on that. So next is there's sort of a couple of ones that sort of go along here. With Miyoko's dog has pica, chewing joints, and is wondering, is this stress or possibly an allergy? Well, that's a thing for you to answer. Number one is, has there always been pica? Has there always been chewing joints? Is this dog living in a very stressful environment and always has? Or did it recently start appearing and you notice in looking at the context of the symptoms that, oh yeah, it's a super stressful time. And then with allergies, I'm going to answer that as I read what Anastasia's question are. She has an old cat and she wants to know, or old cats, and how do you get them to clean themselves and groom? How do you get them to stop meowing loudly? And how do you get rid of little eye discharge that's going on every day? So the answer to both of those questions, and to many of the other questions that are probably here in the 12 messages I haven't looked at yet, is we've been trained. Jeff and I were trained in veterinary school, and you all have been trained by your veterinarians, those of you who aren't already members and getting retrained here, or have trained yourselves in many holistic approaches for yourselves, for people as well as animals. We've been trained that whatever the symptom is, we have to get rid of the symptom, and that something is causing that symptom. So if I have an itchy dog, the vet's going to say, well, let's try steroids to stop the itching. Or they'll say, let's do elimination diet, or let's do testing, skin testing. They're assuming that something external from the animal is causing that problem, as opposed to what we're talking about is every animal is individual and unique and has an underlying energy field, a vitality. Each one of them, their mitochondria work differently. They have a genetic predisposition to problems that are made better or worse by what you're doing with them, which is epigenetics. And when that energy field is pushed off balance by something, is triggered, then the energy field causes the symptoms. So if Miyoko's dogs has a really high energy, and this isn't like, oh, I'm running, I'm playing. This is if their vibrational pattern in all of their cells in their body is balanced and healthy, they might be exposed to stress and they may develop licking and chewing or eating weird things, which is what pica is. But then they'll be back to normal again. They'll heal themselves. It'll resolve. So the key is it's not an allergy. It's not that you have to fix the grooming or fix the meowing or fix the tears. It's that you have to rebalance that whole energetic pattern of the animal. Now, how do we do that? Well, especially with older cats, Anastasia, you definitely need to be working with a homeopathic veterinarian or a really good Chinese veterinarian, or possibly one well-trained in chiropractic or osteopathic or some of the other approaches, Western herbs. That these are the symptoms you're talking about could be related to that the energy pattern has been so damaged over time that it's causing tissue changes like hyperthyroidism, that it's causing some brain changes like some nighttime senility. The discharge on the eyes is often an early warning clue, even in very young animals, that the energy field is slightly off balance. So by working with a homeopathic vet or a holistic vet, a really good one, and you may have to go to one or two, all of those problems, the pica and joints with Miyoko, and all of the concerns that Anastasia has, all of those will resolve. And what you can be doing in the meantime while you're working to get a vet, or maybe with Miyoko, not necessarily needing to go that far yet, is to feed a fresh food diet, is to really work on mental and physical health and create happiness, make sure with the older cats, Gail Pope, who's has done many talks for us and has wonderful hospice talks, which if you become a member, you could access those hospice talks. And those are talking about dealing with ill older animals as well. And she had over 90 at one time, cats over the age of 16. And one of them lived to be 34 that I treated. And mostly it was pure love. She gave a ton of love. And we did homeopathy and a little bit of acupuncture, et cetera. So that's the direction that you need to be going. And sometimes you can be doing it yourself. And other times you need to, if you think it might be stress, well, you can work on that, that type of thing. And you want to avoid toxins and move backwards on that. So post again or raise your hand if I didn't cover either of your questions. Jan says she needs to find a new vet. So go to holisticactions.com/select. Read the entire article. And then for everybody, if you're not a member and not going to become a member, which I say become a member, I think this is the best thing out there for supporting people. You can also do a one-off call with me to get you going in the right direction. I'm not actually taking on patients, but I'm helping you get in the right direction. So it could be a one-off call or 3 sessions working on food or how to help older cats be more comfortable, that kind of thing. So definitely, Jan, you want to find a new vet. Now, nothing urgent. Rubbing his mouth. So, Frigeria is not for tartar. Frigeria is a homeopathic medicine that treats everything about the body. There are over 7,000 homeopathic medicines, and a few of them have gotten a reputation for helping with a particular problem. Arnica, anytime there's trauma, give arnica. Okay, so for an acute, it's either going to work or not work. But something like tartar, that's a remedy is not going to take care of that because you'd have to be giving it every day. And that's not rebalancing the whole vibrational pattern, rebalancing the vital force. So, but it definitely is something to be looking at. There are, maybe Jeff can post a few of these. There are some topical that can help soothe the gums, but you also need to, we would need to, Jen, can you get on? Are you able to be live? Feeding a fresh food diet may be all that's needed. And the new vet who seemed to be scared of your cat, you want to look, if you have to find somebody conventional, if there's nobody holistic after reading my article, you want to find one that is fear-free. So if they're certified fear-free, and especially if you have cat-only practices, often that's a good way to go. But first look to see if there's somebody holistic. Now, that doesn't mean they're all going to be great either. Just because they say they're holistic or homeopathic, they may or may not be great. So, Connie. So, Connie, you're mentioning Dr. Jeff Grognet. He does do a lot of real, oh, you're talking about supplements. He more does teaching, I think. Does he selling supplements too?
I was just answering the person above who had the name spelt wrong. He's got a holistic holistic
educator.
Yeah, but he's got a conference on right now that's homeopathy and something. So I was just adjusting that.
Oh, great. Very good. Yeah, all of these conferences, there's so many of them. They're wonderful. And, you know, we have a Facebook page for those of you who aren't members, and you can post there when you know of a great conference that's coming up. And if you've even logged into our site, you'll probably get an email from us about conferences that are coming up as well and summits. Dr. Grognet has tons of them, and they're very good. So thank you, Connie, for checking in on that. Yep, Adored Beast I was thinking of. What about Peter Tobias? He's selling in Canada, right?
Yeah, there's a lot that ship to Canada. I mean, Animal EO may ship to Canada. You can find a lot.
So, you know, if Christine, since the eye's been that way ever since you got her, I'm not sure I would worry about it. I would take some pictures and make sure that it's not changing. That could just be who she is. So if everything's going well, Dr. Jeff and I disagree maybe a little on this. I'm not sure I would even do the ophthalmologist in June.
Yeah, not if it's been there all this time, for sure.
Yep. Yeah, I would. And that's one of the things that, and it doesn't bother her, so that's great. Yep, we all have different, certainly different things. Carol has thyroid carcinoma. So what we would suggest is working with a homeopathic veterinarian, and I don't know if you've selected the Zhu Fuzhu and Yutang, or you're working with a Chinese medicine veterinarian, but you need to be working with a good one. And then the key thing is number one, we're all going to die of something. Your animals will die, absolutely. And so the key is, how are we living however long we have with our animals? What's our quality of life, yours and the animals? That's what we want to be focusing on, is living today. And then you make a list of any symptoms that have ever been there in the past and are there currently with the thyroid carcinoma. And then you may need to use things. So you may be doing some cancer supplements. You may be working with a great homeopathic or holistic veterinarian who's doing, or Chinese medicine veterinarian who's also recommending hyperbaric therapy, or Beamer, or there are multiple different approaches. But the key is you focusing on quality of life. What's the beam? Happy, behavior, energy, appetite, and mood. And then you add in something else, see what happens. You try a different therapy, see what happens. You learn Reiki or Eden energy medicine or any theta healing, any of the energy medicines, and you start doing that, the Bingston method. and you start doing that. The Bingston method is particularly good for cancer. And Bill Bingston recently died, but I'm sure there are people that are, I know that we had a speaker. If you're a member, you can tap into his lecture that was this year, and talking about his practice. And it's particularly, Bingston is particularly good for treating tumors. And his book is The Energy Cure. And the appendix has how you can do it yourself. You learn to do this cycling approach. So I would definitely, again, focus on quality of life, not necessarily eliminating cancer, but quality of life. Karen. Okay, so you may want to look at, so Karen, why don't you post that in, so Karen's asking, she found holistic vet recommendations in the area. Now, okay, you said you checked out HA holistic vet recommendations. And Dr. Jeff, we need to check on this because someone else said that phrase to me. We aren't making recommendations on the website for specific vets. Sometimes in answering your forum questions, we'll make a specific recommendation. So it might have been that. But in the select, holisticactions.com/select, we're telling you how to go to all of the different websites. And so you can read that article, go to all of the websites, find some that are doing.
Stop it! Lay down.
Nope, I don't want to lay down right now, Sharon. Thank you for muting. And you may find one that's a little less expensive, and then you have to so there's more to it. Find out what they do, who recommends them, things like that. It is an issue where you have to look at the short-term, more expensive cost versus the long-term costs. And it's a challenge. I totally agree. So post it in the forum and let's do some more talking about that on the forum. Bad breath, Sherry, is often caused by problems in the mouth. So here's another thing that we recommend everybody do. So we make lots of, there are some things that, like, if everybody did them, we'd all be healthier. If I did all the exercise I should do every day, I'd probably be doing better. If I didn't succumb to my sugar cravings as often, I might be doing better. So it's not just our animals, but so we are seeing some things. Yep, being on a fresh food diet could help the breath. And another thing is, why is the bad breath there? So one thing we want everyone to do is, whatever age your dog is, cat is, to train them to love being examined, so that you go, okay, Susie, it's time for a treat after we look at your mouth. Open your mouth. And the dog goes.
Was there. Caitlin, thank you for that. We appreciate it. Let's talk more now with Jeff Schwartz. He's a former.
And you go into the mouth, and can look. You can see, is there tartar? Is there gum inflammation? Is there an ulcer? Is there something that might be causing the bad breath? And if there is, then with the HMDM, your goal is to find out, okay, now let's do research to find out how we want to address this. But in general, fresh food and feeding some bones that are digestible, that are small enough to be crunched, or just huge chunks, depending on the animal's size, where they can sink their teeth in. Look, they're cleaning their teeth. Oh, that's the best way, because that's how Mother Nature does it with them. Okay, Chell. Oh, back to Ruth, your rescue that's near you, and Chell, your rescue and Jeff, I may want to have you answer that question if you're reading it. In June, we're talking about quality of life for the people that work at shelters and rescues and the animals. And so we've got 3 wonderful speakers coming, and we're giving people who are who work in rescue organizations or groups. I don't know, Jeff, you could speak to that. 1 month free membership, because we want every rescue that anybody knows about to be exposed to the wonderful possibilities that we can do in a rescue. Because if you can do some of what we talk about, like if you can do EFT for the people and the animals, or you can do Reiki, which helps the people and the animals, sometimes then you don't have to work with specific issues like mycoplasma. Can you speak to mycoplasma specifically, Jeff?
Yeah, I could, but it's going to come back to doxy, which they've already done, which is why what I would say is that the germ, in this case mycoplasma, is really not the problem. It's a symptom of the problem, a symptom of what Dr. Christina mentioned, and that is the imbalanced vitality or energy balance. It's what we call the inner terrain or environment. And if you can optimize that, with mycoplasma in particular, but really any germ or any stressor of any sort, optimizing that inner terrain with fresh food, lots of exercise, lots of happiness, homeopathy if
So she
possible.
said they feed fresh food and gently cooked, which is great. They're using adored beast gut soothe, liver tonic, and did rebalancer. And that is what you need to do. So now let's see, and you can correct me here on this if you want, Dr. Jeff, but if the congestion and runny nose becomes so severe that this kitty can't breathe, then you may have to go back on doxycycline. But in the meantime, accept the symptoms as clues that you haven't quite figured out what to do yet. And so other things that you could try could be any of those energy healing that I'm talking about, could be acupressure. So you're treating to rebalance the whole kitty, and you may need to use some acupressure for upper respiratory symptoms, or some again, Reiki, etc. Any other those things that might help with the sneezing?
There is a lot of things. Look at the respiratory tonic, which is an herbal mix from Pet Health and Nutrition Center. I guess my first question would be, and maybe it's here, but I didn't see it, is how old is this kitty?
Well, it's
How
something
young?
they have going on they're challenged all the time there with it. So it's not just
I see.
this
It's
kitty.
not just that
It's
one.
a rescue
Got
group.
it.
Yeah. They
Yeah,
sometimes have
then
mycoplasma
Reiki every day, maybe start
or
dealing
any of the
with
energies.
Sarah or any of the energy. Yep. And
But
it would
maybe you
be
could
marvelous
post a
to
few
start.
of the respiratory type of, and the thing
Sure.
is, it is a matter of continuing to learn. I'm just drawing a blank right now for you, but I would be looking up in my books, which are some of the different ones that help with the respiratory system and for helping the symptoms. But the key is, so here's one thing is keep track of any cat diagnosed with mycoplasma or other problems when you're getting them in. And then look back to see, did they come in with that? Did they develop it 2 weeks after they got there, for a month after they got there? How long have they been there? So try to look at the context of getting it. And maybe you can find a thread that you'll go, oh, maybe we need to be giving aconite to cats that come into the rescue, because 60% of the cats that come into the rescue are developing some form of upper respiratory. And aconite is a great for fear and upper respiratory early infections in general, and often is used in shelters. Or it could be arnica, because they've experienced physical trauma as well as mental trauma, and that could be triggering any of the different diseases. So if you look at the patterns and the context, then that may help you figure out how to deeply prevent this from happening.
And the biggest factor in shelters really is stress. And emotional enrichment, environmental enrichment, petting, playing, all that can help reduce this a lot. So with all the kitties, too, so I'd want to know more about as a shelter vet back years ago. Thing I would ask is, are they exposed to the outdoors? Do they get daily visits? Are they stressed in any other way? Because that stress is perhaps the worst thing for the inner terrain. So a well-balanced individual, when they get stressed, they can still get sick because the terrain is off.
So, Chell, thank you very much for reminding me that bad breath can be kidney disease in older cats. The bad breath there is usually very ammonia-like, and that would go along. It's usually not the first symptom. It's a little bit further down. So you will have usually already seen some issues with increased thirst, maybe increased urination, a little bit of appetite issues. But it definitely is something to keep in the back of your mind. So thank you, Chell, for adding that. And Miriam, you have to be a little careful in extrapolating from medical medium, because he's not necessarily talking about cats and dogs. He's talking about people. And yes, bad breath, as I mentioned, is often a cause of poor diet and poor digestion. So feeding a fresh food diet is definitely important. And reconnective healing, Chell, thank you. We have not had a reconnective healing practitioner, and there's some really great books on that. Chell, are you a member? Do you know if she is or not, Dr. Jeff?
I am not sure.
Okay, if you are, or if you become one, be sure to post in the forum, in the thread on practitioners, that you do that. That would be really good. Sherry, Dr. Jeff, besides Adored Beast, what was Sherry asking about? Sorry. Bad breath. Oh, just fresh food is really
Phoebe is maybe a picky eater. No, actually, just the opposite. She's a big eater. So yeah, fresh food, big chunks, and all the stuff you recommend should work really well.
Yep. And it might be for a month or so you need to try a probiotic, or you might need to try a prebiotic. We don't recommend needing to do that for a long time. If you do, then you haven't gotten a complete balance. Now, in terms of bones, Miyoko was told to ditch the antler and the nylabone. So there are two different people feed bones for two reasons. One is edible bones that are basically swallowed almost whole. And that's for the calcium that's needed to balance the phosphorus in the raw meat. If you ever hear of anybody who's just feeding their dog ground beef and green beans and is not feeding a calcium supplement, you need to really get on their case. So dogs and cats need to balance the high phosphorus in the muscles with calcium, whether it's edible bones or not. Then we have bones for just boredom, chewing, because they do it in the wild. And my experience has been in the last 15 years, maybe even 20 years, I guess now, I have seen more broken teeth than I ever used to see. And I think that's because many dogs are just not quite as healthy as they used to be. And while I know people feed antler and their dogs are wonderful with it, I've had ones that broke their teeth on it. Same thing with nylobones. So there are other things that are out there for them, but make the distinction between chewing and calcium and the source of calcium. So I wouldn't necessarily do a pain panel right off the bat. I would instead start, her beam is good. Is it great? That's the key. And the pica, you have to stop and really look at the context of the pica. What is it that she's eating? Because some people think it's pica when they're eating squirrel poop and rabbit droppings or deer droppings. That's normal. It's just when they're eating carnivore stool or their own stool. And although we're getting more into the springtime now, in the winter, that first really hard freeze or snow, when there's poop that's frozen, there are a lot of dogs that seem to like poopsicles. And they just eat them for a week and that's it, and they're done. That's okay. Yep, go ahead.
When I say pica, it means not poop. Poop's not really the big problem. But since, anyways, in her last year and a half, she's eaten a child's hat, a glove, a piece of panties. These are all things that were on the street, dirty on the streets and stuff like that, and plastic bags. And so there's been about 5 incidents. So I've watched carefully, and I've watched them go through her digestive system, sometimes even twice. And, but people say that's pica.
Well, it is, but now you have to look at the whole context of it. They just may smell really good.
Yeah.
And the key thing for that is that may not be an underlying energy imbalance, except that it just happened in the last year. So that could be, although let's see, she's only 21 months old. So that could just be normal. You need to train her on drop it.
Yeah.
And train her. Actually, our dogs are so smart. We just have to really train them. Train her before she puts anything in her mouth to look at you and get approval.
Mm-hmm.
And it may take, a lot of focus on that. But that, since she's already been doing this, it may save you some surgery. So it would be worth putting a lot of time into that.
Yeah.
And the nibbling on her joints, she's only 21 months old.
Yeah, she always was doing it a tiny bit, but now I actually really notice it because there's some hair loss on her wrist, you would say. Yeah.
So the key is, again, rebalancing the energy field with using all the things we've talked about. And sometimes we just don't know what it is that's triggering it. So I had on my thumb here a spot that looked exactly like a lit granuloma. It was thickened and it was itchy, and I'd have to stop myself from itching it or put on a glove or something like that. I had that for several years, and nothing seemed to be affecting it. And then one day I did a kind of therapy where you put a pen or a stylus on a spot on any kind of pain, and then you lose your focus and you try to figure out what in the past created that. And I played around with that for a while, didn't necessarily notice a big change. And all of a sudden the other day I went, oh my gosh, this is not only completely gone, it's been gone for the last year.
Mm-hmm.
And so you never know what's going to shift things like that. So I would, palpate both legs, palpate for pain, watch carefully for pain. Lori McCauley, if you can put that in, Dr. Jeff, is just a wonderful rehabber, and she has a ton of YouTube videos that talk about how to have dogs walking like on a hillside, so they're walking sideways, walking backwards, getting up on the fireplace with their front legs or their back legs. And part of that is making sure you're developing all the muscles. And then part of it would be to notice if there is actually pain, evidence of pain. So paying attention that way to see if it's pain.
I have been palpating, and I know I understand the symptoms of pain, so I've been really keeping an eye on her. She does a lot of movement puzzles, which is actually different kinds of movement,
Good.
videotaping her and, getting feedback
Mhm.
from the guys. So she's very active. She doesn't have really long walks. We have very slow, calm walks because I'm also studying with the Nordic Dog Institute for calming signals, with the
Great.
Norwegian lady. So it's actually really great. So she's changed quite a lot. So before she was like kind of nutso on the short walks. Now she's just calm.
So maybe when she starts to lick, um, check and see if something's going on in the house that is causing that, and she needs in-house calming, something along that line.
Yeah.
And the other would be to look at flower essences if you think there may be some anxiety going on, because they're totally safe. Tellington Tea Touch, another one totally safe that certainly works with that, and also has, for everybody, it has great ways to train puppies. Okay, some quick answers. Dr. Jeff, let's see, testing positive for Lyme test. If there are no symptoms, don't worry about it. And very often you'll get a positive Lyme test on these when you're testing for heartworms. And if there are no symptoms, just don't worry about it. Now, it doesn't hurt to test, but I would say you do not need to. And dissolving struvite stones, the answer is basically what we've been saying all along is, well, she said she can't afford to work with a homeopathic veterinarian. So Jeff, are you feeding a fresh food diet? Another thing would be to go to, there's a Holistic Cavalier Facebook page that's great if you're not a member here at Holistic Actions. And that'll just give you good support and checking the diet and how things are doing from a Cavalier standpoint. Energy levels are good. There are some. So how long, you have to look at how long that stone has been there, and is it causing any problems, or was it, and don't go with the diet for dissolving struvite stones. That's not that good. You want to add anything to that one, Dr. Jeff?
It would really depend on the context. Is it one big stone? Is it lots of little stones? Is it one little piece of gravel? No, I don't know.
Great.
I
Okay.
usually just see stones dissolve as we improve their overall health. Unless they're really big stones, in which case they have to get removed sometimes.
And Miriam, if you're not a member, it's not that's not that expensive to become a member, and you can post on the forum 24/7. So you can really get a lot of feedback about how you can be helped with these issues. Because we'll ask that question, how big is it? And then we can answer you differently, which we don't have time to do with all of that. Chell, yes, post.
I just wanted to say Miriam's has texted or chatted that she is a member and has been for 3 years.
Oh, good. Well, have you been posting, Miriam? If you post, then, oh yeah, yes, and member. Oh, bleeding. So it's a small stone, and bleeding, and we can spend a tad more time here because that's it. Oops, and we have Michelle who raised her hand. So definitely be sure to keep posting. You saw me and Finland.
I would just add one more thing, and that is, structured water. I'd be starting right away by making structured water, which can, as a member or anyone, can just type structured water in the chat. And there's a thread that pretty much summarizes all the different benefits, including dissolving stones, including the body work better. I'll never forget the one member who went on structured water herself, and her migraines of 30 years went away. just from structured water, right? Jenny knows about Francine's story.
Yeah, that's really wonderful. Okay, Michelle, unmute.
Hi, sorry that I'm off
Hi,
camera. I'm walking
that's
and
fine.
I don't want you guys to get vertigo. So I have a rescued Frenchton who has all the allergies, bless her, from the Frenching part. And so she doesn't eat, she can't eat a lot of proteins. I give her cottage cheese, quinoa, and I supplement with fish oil, some greens, and some other
So,
acidophilus, etc.
so Michelle, she's not allergic to those. Those are
She's not,
triggers. Those are
yeah,
triggers that are pushing her vital force off balance. Those are
okay,
triggers, and while temporarily you may need to avoid things that are triggering her, often if they're fresh meat, like fresh chicken, they won't trigger.
right,
But even if it's
okay.
fresh and triggers it, then you need to be working with a homeopath, Chinese medicine, energy medicine that you're doing yourself. All of these
Right.
others, like, it's like you want to think about the rebalancing. Now, I know I
We,
interrupted you. What's your specific
well,
question?
we did a lot of homeopathy. I could open up a
Yeah.
homeopathic shop with the number of remedies, and we just didn't see
Wow.
impact. Um,
Okay. Who
so
were you working with? Who was your homeopath?
Shuli in Canada, Shuli,
Okay, right.
and she's, yeah, yep.
And so that was
So
the only one. Okay.
that was the only one, yeah. So, I guess my question is, she's been barky and more, I'm nervous. I do supplement with some proteins that she seems less reactive to, like pork or salmon, typically the high grade canned foods.
hmm
But I'm
Why are you not doing
worried.
fresh?
Um, I think lack of knowledge and time. I'm a working single mom and just time. So I just don't know how to do it,
Okay.
really.
And
Um,
you're a member
yes,
of
I'm a
Holistic
member.
Actions? Okay. And I
Yeah.
know even there's just so much and time-wise, it can be a challenge, but why don't you post that
Okay.
you'd like to switch to fresh? And
Right.
are you and your daughter vegetarian? Or I don't know. Why did I assume you have a
No,
daughter?
we're not. No, it's a son,
Okay.
and no, we're not.
Sorry about that assumption.
No,
Um,
no worries. No worries.
so given that you guys are not vegetarian, then what you do is you simply include your dog with whatever you're eating
Right, right.
and reread the 101 nutrition. Click on the
Mm-hmm.
nutrition button. Take a little bit of, carve it. How old is your
Mm-hmm.
son?
He's 16.
Oh, good. Well, make him sit down and do it with you.
Mm-hmm.
Say,
Mm-hmm.
I need to do this, and I feel like I don't have enough time, so I need your help.
Right, right.
Maybe. I don't know if that
Yeah.
works, but
Yeah, yeah.
it's an idea.
Yeah.
And what you'll find out is if you guys are having steak, then when you're at the grocery store, you look for the cheapest. Well, I'm sorry. How much does your dog weigh? About.
14 pounds.
Okay. Oh, well, then you don't have to worry. Whatever you're eating, you just
Right.
cut off a hunk of the steak. And
Okay.
the biggest hunk that the dog will eat, you let him work on it. So if you're having salmon, fresh salmon, then you give a hunk of the fresh salmon to your dog, raw or cooked.
Okay. And if I
And
see a
then,
reaction,
well, you're going to have to be doing other things.
right,
That's just step one. Step
right,
two
right.
is you do need to be working on the underlying energy field imbalance. And what did Julie say when it wasn't working? Did she say, I don't know, I'm stumped? Or did she say,
At some point, because again, I could have opened up a
right, sure,
homeopathic practice with the
right.
number of remedies we
Well,
tried.
ask her if
So,
she's willing to consult with, if she's a member of the Academy of Veterinary Homeopathy, she can consult with other homeopaths.
right, right. Okay.
Or think about working with somebody else. I
Yeah,
frequently, if I got stumped with somebody, I'd refer them to another homeopath because
yeah,
each of
yeah,
us has blinders. And
yeah.
sometimes I'd refer them and the second homeopath would retake the case. They'd do the same remedy, but in a different
Right.
potency, and it
Yeah.
worked.
Yeah. No,
And it was
that's
just,
great.
I
That's
had
good
either not
advice.
gone back to that potency or something. So we sometimes have blindnesses, and
Yep.
you need to be paying attention to beam and how because it's long term. So,
Right.
and are the allergies, here's another point for everybody, are the allergies skin or digestive?
Skin.
Okay, so skin, everybody, if you can keep your dog or cat or person or any living being's problem on the skin, yay! It's wonderful. No dog dies of skin problems, no matter how bad they are. So be thrilled with skin problems and then start working through. So post in the forum, review the nutrition for the nutrition part, but definitely post in the forum and
Okay, great.
just take the time. And you don't have to do the whole long post. If you've already done that once or you don't have time, that's fine. But if you just say, okay, this itching I can't stand, what can I do temporarily? I've tried
Right.
ABCD. It's fine to
Yep.
do shortened posts if you want to.
Yep. Okay. That sounds great. Thank you. Very helpful.
You're
Sure.
welcome. Dr. Jeff, that's
we
it.
have to run, but I just want to add, when it comes to quick and easy fresh food preparation, Instant Pots are amazing. You just what Amy does is go in the fridge, whatever we have, she puts in there, and that's, the meal. So it's really,
Except this is
really,
for a 14-pound dog, so they can just eat whatever the people are eating.
if you can do that, that'd be awesome as
Yeah.
well. Well, thank you all for coming. We really appreciate your time and
Sherry,
energy.
send an email to, is it support, Jeff? Support@holisticactions.com for help.
Yeah, and Sherry
Yeah.
gets a coupon every month that gives her
But just
also it's gonna ask for your
just go to support. She'll go to support. They'll handle it.
support of holistic actions. Yeah.
Good. Okay.
So thank you again, everyone. We'll see you. Well, Monday is the member tour. After Monday, in May, it'll be
May
our
5th.
preventing and managing behavior issues with all these strategies and energy medicine and all the good stuff. But thank you. Enjoy your spring. We will see you next month, or we'll see you in May. Bye.